New South Wales recorded 50 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 37 locally acquired cases are linked to a known case or cluster, and of these, 23 are close contacts and 14 are household contacts of previously confirmed cases. And the source of 13 cases is under investigation. 2 new cases were acquired overseas. The testing rates have stayed up, but I challenge us to get out in higher numbers and be tested. In terms of the ICU and hospitalisations, we've got 47 people hospitalised. COVID is a severe disease associated with hospitalisation and, tragically in some circumstances, death. It is critical that we follow the stay-at-home rules. I'm making an impassioned plea for the community this weekend to follow diligently the advice we've provided. And I think you'll understand the reasons for my growing level of concern that we need to bring these case numbers down. There are 19 people admitted to hospital at the moment with COVID are under the age of 55. And of those, 8 are under the age of 35. Of the 16 people in ICU, 1 is in their teens, 1 is in their 20s, 1 is in their 30s, 1 is in their 40s, 3 are in their 50s, 6 are in their 60s, 2 are in their 70s, 1 is in their 80s. Of the infectious cases in the community, 26 were of the 26 that were infectious in the community, 13 were in southwestern Sydney Local Health District, 11 in southeastern Local Health District, 1 in Western and 1 in Sydney. But can I just say, across Greater Metropolitan Sydney, whether you're in Central Coast or down in our southern end in Wollongong, Shell Harbour, right across to Blue Mountains, everyone needs to consider that every time they leave the house, they have to minimise their exposures to anyone and follow the health advice. As you're aware, only 1 person is permitted each day to go shopping, and it should be for essential shopping. And you should have a clear understanding of what you need, and if at all possible, purchase it online. In terms of the key messages for today, I just want to also highlight the consequences of actions. So 10 further cases have been reported linked to the gathering at the Meriton Suites Waterloo on Saturday the 26th of June. So these cases are contacts of the people who attended the gathering and bring the total number of cases linked to this venue to 35. I think what we're seeing is chains of transmission, and we're having difficulty getting ahead of those chains. We need everyone to stay hunkered down this weekend, stay within your household, and if anyone in your household has the most minimal of symptoms, get tested. Echoing the Premier's words, it's critical that you tell the truth the first time. We know that everyone is human and makes poor decisions at certain times, but please don't compound that initial mistake by not telling us the truth the first time. At the moment, as we're trying to get ahead of the spread of the virus, we haven't got time to waste unpicking stories, going back and cross-checking and verifying. It is really essential, tell us the first time. What we're concerned is our sole focus is preventing the spread of COVID. And my final message is that your loved ones and those you care about most are those that are going to be impacted if we don't follow the health requirements and the advice. And I think no one wants to do that. I also want to make sure that people are not concerned about having a COVID diagnosis. The best thing you individually can do is to know that you have COVID so that we can care for you if your condition requires hospitalisation or admission to intensive care. But also, if we can get ahead of the curve of the spread, we can protect your loved ones. So please think about the ones that are the most dear and near to you, that is who will be touched by COVID if you have it. Thank you.